Well, the best time to see someone is when you think you need to see someone. Yeah. And you know yourself better than anyone else. I usually tell people, if you have a history of a mental illness, such as depression, anxiety, OCD, PTSD, psychosis, but the list goes on. If you have a history of it, get someone on board. Even before you attempt.
Before you get pregnant.
Yeah, before you get pregnant. Preventative medicine is the best medicine.
Yeah,
So
absolutely.
getting them on board, because if you don't have your mental health, you've got no health. There is no health without mental health.
Hi everyone and welcome back to No Place Like Home. I'm Jess. We're here with my wonderful co-host Larissa.
Hello.
And the wonderful Dr Edna Lekgabe, who is a perinatal and reproductive psychiatrist. What a title.
What a
Thank you.
mouthful. I know.
Thank you so much for coming.
Yeah.
Now, usually we would go into your, the format when we have guests is that we talk about your personal story first and then we talk about your field of specialty in the subsequent episode. But given the nature of your work, we thought it's best to perhaps have some boundaries in place and keep your personal story around birth and postpartum private, and we'll just go straight into your work.
It's going to be very informative. So
Very, very informative.
buckle in.
So should we start with your background and qualifications?
Yeah. Thanks for having me here.
Oh, you're
firstly.
welcome.
Thank you so much. So my background. So when people ask me, what's my background? I always have to stop and think, are they asking me my personal background or are they asking me my professional background? So anyway, I'll tell you a bit of both.
Yeah, cool.
So I'm obviously African, East African. I came here when I was how old was I? 16, so late teens for school. Yeah, school. And then I stayed on. And fast forward a few years, I now have 2 kids.
Amazing.
A 16-year-old and a 2-year-old.
How's that? Oh,
Don't
right.
ask.
Okay, well, I'm not.
Don't ask. Don't
I
know
want to
what
go there, Dr.
I
Edna.
know,
I want to go there. Anyway.
16 and 2. I'll tell. Well, 14-year gap. I think it was the schooling, the studying, the work. Life gets in the way of things. So it's 16 and 2. So it's pretty challenging. It's hectic, as you can imagine.
Yeah.
A toddler and a teenager.
Yes.
So
Such different spectrums of parenting.
but yet same.
And so
Right.
turbo. I imagine both are very
Boundaries.
turbo. The 16-year-old would be absolutely insane and you're trying to make sure they stay safe at all times, and same with the 2-year-old.
Pushing boundaries, both of them. So it's but different little boundaries, big boundaries. So it's quite challenging, but thankfully I have a lovely partner in life,
Makes a difference.
Yeah, it makes a huge difference. He's been around for 20 years. So he's my rock and, helps me navigate these 2 challenging, strong, fierce little women.
Yeah.
So that's my personal stuff.
Yeah, sure.
Professionally, so where do I start? So I had to think about this last night. Where do I start?
Everyone always says that when they come, they're like, there are so many questions that we kind of give guests to preempt. And they're like, I've never really sat down and thought about it. Yeah.
And it was frightening to actually think about it. How many years I spent in learning. 17 years, I calculated it. 17 years of university and exams. So I was thinking, oh my God, how many exams is that? Way too many. So a bit of my background is that, did science, biomedical science, did an honors degree, did a master's, did a PhD, then decided to do medicine, then did psychiatry training. And that's 17 years.
Goodness.
Hence the 14-year gap.
Yeah.
That's what I was doing. That's what I was doing. Yeah. That's me. 17 years of
Learning.
training to get to perinatal and reproductive psychiatry.
And while you were studying, did you have an understanding of where you wanted to arrive, or were you in I'm still not quite sure where I want to land? Because it's sort of medicine and then...
I always knew I was interested in biology. I was interested in humans. I was interested in how the body works. I come from a long line of medical health professionals, so I knew that's where I belonged.
Yeah.
And I always knew I was interested in women's health. So that I knew. So that was always my North Star.
Okay.
Knowing that I was going to be in healthcare, with women. What it looked like, I wasn't sure.
Yeah, right.
Thinking about actually how I got into perinatal psychiatry, because it's very specific, it's very little niche little space. Everyone who knew me in medical school knew that I would be an obstetrician. So that's where I was headed.
Okay.
I was like gung-ho, obstetrics and gynecology. That's where I'm headed.
Right.
Very clear, topped my class, very sure, won the award. I was like, yep, obstetrics and gynecology. Start working in obstetrics, loved it. And then I not accidentally, when you're a junior doctor, they place you in different jobs. You do a bit of general surgery, a bit of general medicine, a bit of psychiatry, a bit of this, a bit of that. And I ended up doing a three-month psychiatry rotation. And I was like, what's this?
It sparked your interest.
Yeah. I was like, hang on. hang on. I kind of like this.
Wow.
You know.
Did you think to yourself, no, this means more study? Stop, Edna.
Yes. And I was like, it was like almost like an identity crisis because I knew what I wanted. Yeah. I was like,
that would have been.
Had it.
I was like, yep, 100%. I'm heading this direction. And penny dropped.
So for anyone listening,
Yeah.
I guess I'd love for you to outline what a perinatal psychiatrist is, but also what the difference is between a psychiatrist and a psychologist.
I get that a lot.
Yeah.
I get that so much. And I don't actually correct people because essentially psychologists and perinatal psychiatrists, we both work in mental health, supporting women through their mental health journey. But there is a fundamental difference between the two.
Yeah.
And it comes down to education and training. It comes down to that, and also comes down to the treatment modalities that psychiatrists give and psychologists give.
My understanding is that psychiatrists can prescribe medication and psychologists can't. Is that correct?
Yeah. A bit more than that. So if you go back to the education and training, psychologists do a bachelor's degree plus or minus a doctoral degree, and they're extremely well versed in psychological therapies, the practices, and doing that. They're very, very good at doing that. Psychiatrist, different training. You just heard 17 years of my life. You go to medical school, you train first as a doctor. First and foremost, you're a doctor. Yeah, you have to. Well, yes, you train as a doctor and then you subspecialize in psychiatry. And as a psychiatrist, our job is to diagnose, treat, and manage the mental illness. So it's yes, we do get to prescribe.
Yeah.
And we do get to do the talking therapy that psychologists do as well. But we work very well together.
Yeah.
Psychologists and psychiatrists, perinatal, hand in hand.
So it's not an us versus them thing like you sometimes see in other.
Yeah. No. I can't work without my psychology colleagues. So it's so important.
I love that.
Yeah. We got to, it takes a village to raise a bomb. Yeah. So work very well with psychologists, but we're very different.
Yeah.
We have different lenses, different expertise.
Different lenses.
Yeah.
Which is so great for the patient.
Correct.
Right?
Yeah.
Like just that cohesive relationship between someone who might be experiencing mental problems initially and be still with their psychologist and have that relationship and love that, but then might get into some deeper territory and need psychiatry, but to still be able to have that relationship.
Both.
Yeah.
And not lose that.
Beautiful.
And the way a perinatal psychiatrist works is you're working in collaboration with the psychologist. So they do the therapy. So typically what I find myself doing is doing the medication side of things because you don't want to do double handling. Yeah, double handling. It's confusing for everyone. The poor mother ends up sharing a bit of here, a bit there. It's all a bit confusing. So it's nice to have the therapy with one person and the medication with the other person. So it's nice and clear and clean in that way. So both are needed. Very different, but same. Yeah, right.
When should someone seek help for perinatal psychiatry? And I know that that's probably a really big,
I know,
a broad question. Yeah. But for anyone, we always do everything for our listeners. So for anyone who is listening that may be experiencing things themselves or know someone or.
Yeah. When do you, the best time to see someone is when you think you need to see someone. Yeah. And you know yourself better than anyone else. I usually tell people, if you have a history of a mental illness, such as depression, anxiety, OCD, PTSD, psychosis, but the list goes on. If you have a history of it, get someone on board. Even before you attempt.
Before you get pregnant.
Yeah, before you get pregnant.
Yeah.
Preventative medicine is the best medicine.
Yeah.
Absolutely.
So getting them on board, because if you don't have your mental health, you've got no health. There is no health without mental health. So if you know you've had a history of it, you've experienced it before with your own child, or even without a child in a different time in your life, and you're well now, get someone on board. If you're experiencing symptoms right now of depression, which are persistent, it's not just an off day. It's not just a bad couple of days. It's something that's persisting. Feeling sad, feeling hopeless, helpless, worthless, feeling guilty, having thoughts of harming yourself, having thoughts of harming others, feeling anxious, feeling really worried. We're all worried, but what's more than normal?
Yeah.
When it gets in the way.
Hypervigilance.
Yeah. When it gets in the way of actually being able to sustain relationships. Live. You can't live, you can't sleep. If it gets in the way of life, see someone, And the other time to see someone is if you've tried everything else. You've tried meditation, you've tried yoga, you've tried everything. You have tried hanging out with your friends. You have tried everything, and you're finding that you're still struggling. That's the time to speak to someone.
And the struggle looks different for everyone, doesn't it?
Exactly.
Yeah.
Exactly.
Your struggle might be a quiet struggle, but it's within yourself, which is sometimes can feel. I vividly remember how I felt during my time, and it's a very silent struggle because you're not kind of really telling anyone, and the facade's really good. So it can be a quiet struggle. It doesn't have to be like an obvious, like, I'm not coping.
And so the quiet struggle is the hardest to pick up. But the quiet struggle, I wonder whether, I don't know about your case, Lisa, but whether your family could tell. Could they tell?
It's interesting because
could they tell?
Not a lot of people, well, no one really knew aside from my husband. And even when we recorded the episode that I talked about my story, the amount of friends and family that contacted me after that aired saying, I had no idea. Why didn't you say anything? I was like, well, we're been and gone. I'm not going to go into it now, right? But
mental illness is just often invisible,
There were a lot of people around me that didn't know, because I think I just became really bloody good at
masking. Soldiering on.
And those, but all of those, like in the shower, it was really easy for me to do the obvious, I'm not struggling, but by myself, so I found all of those pockets for it not to be obvious.
That's hard. That's hard when that's happening, and you're not alone in that. There's thousands of women that I
But at the time,
felt alone.
At the time, it was like, it just felt really isolating. But then obviously,
It's also just so hard for people to ask for help because they worry that, they're going to be told they're a bad mother and they're going to have their baby taken away from them. I don't know if you've read the book Sad Mum Lady.
No.
So it's by Ash Davenport, who is an old acquaintance of mine. And she had a blog when she was pregnant called Sad Pregnant Lady. And then when she became a mum, she turned it into Sad Mum Lady. And she wrote a book, and it's about her postpartum depression. Yeah. And she said, she was scared to seek help because she was worried that
child services will be called.
And so I guess that leads into the question of, what does help look like? Because a lot of people, as you said, it feels so lonely and isolating, and you feel like you're the only one who's struggling when really there is so many people out there who are also struggling. And people like you are there to help. You're not there to take people's babies away or put them in a padded room unless that's where the safest place for them is.
Correct.
What does help look like for people who come to you?
A lot of people.
Broad.
I know. A lot of people ask, when people come to me, they don't even know what it looks like.
Yeah.
They've never seen a shrink.
Yeah.
They've never seen someone like me. So they come in and people usually look
Feels
frightened.
daunting.
Yeah, coming to see me. Oh my God. Frightening. So what does it look like, seeking help? Well, seeking help is firstly going to someone you trust that you can speak up to and just say, hey,
okay.
I'm not okay. And it's hard for you to know what's okay and what's not because the organ you're using to think and make decisions is not working. So it's hard for you to actually make.
Of course.
Do you know, if you have a broken arm, it's easy. It's like, oh, I've got a broken arm. You can make a rational decision about going to hospital. I need help because my arm is broken. Whereas when your mind's broken, how do you use that to go fix it? It's broken.
Yeah.
And make decisions.
It's hard. So this is why then, what does help look like? It looks like first speaking up to your loved ones and just leaning into them and saying, I think there's something wrong. That's the first part. Just starting there with the people closest to you, mom, sister, friend, neighbor, partner, whoever it is that that you trust. And expanding from there. And by telling this person, you're putting words to it. And that actually gives you a bit of practice to actually, because sometimes it's all in here and you haven't actually put words to it. So you're just speaking to someone, just talking your thoughts out loud. Is it all in my head? What's going on? And then the next step is to see your doctor about it, your GP. And if you already have a psychologist, great, but sometimes you don't. So you see your GP. And just talk to them about what you're feeling. And they usually can direct you to someone like me, And when you come and see me, my first job is to calm you down.
Yeah.
To say, you're here, well done for coming.
Yeah.
It's the biggest step, coming. And once you're there with me, I then have to understand who you are and what's happening. And that takes time, For me to be able to tell you what help there is, I need to know what's going on. And how do you tell a stranger? Like if I was to see you, you would have, been like, everything's great, it's hard. So it takes like 2 or 3 sessions for me to really get to know the person and find out what's going on, a bit about your past, your present, your family history, your medical history, because your physical health impacts your mental health. What's going on? Is your iron low? Is your thyroid malfunctioning? What's happening? What's happened in the past with your mental health? Yeah. Have you had struggles in the past? How does it show up? Then we forensically analyze, and then together we sit together and then think about a label. What is this? Giving it a name. Because for you, I don't know whether you actually even knew what it was.
It's just so interesting listening to you because I often wonder what would my treatment have looked like or what would it have been if I actually at the time, because I did get to that point where I had to say to John, I'm thinking about hurting myself and I don't think that's
usually
normal
thought process.
Yeah. And I often wonder, and interestingly, so the first thing we did was we sought out someone for the baby.
For the baby.
Yeah, we were like, so we'll get a mothercraft nurse to help what's going on with Valentina and then that will help me.
Yeah, interesting, isn't it?
Yeah.
That focus goes straight to.
Yes. But I often wonder what my treatment would have looked like if we had have been like, well, we need to go to the GP.
Yeah. And just start there, just to say, what's it? What am I? Yeah. And then get directed, and then putting a label on it. I hate labels, but sometimes they're actually helpful in understanding. We're then able to communicate about it and communicate to your GP, communicate to your partner, your family. This is what it is, and then we can start. So we're not treating the label; we're going to be treating you, the person sitting in front of me, and saying, okay, this is what we're doing. We're treating perinatal anxiety. We're treating perinatal OCD. We're treating burnout, adjustment, whatever it is. And if we can agree that that's what it is, because I wish I could do a blood test in psychiatry and be like, blood test. Imagine. Blood test. Wow. And there's a test.
Yeah. That'd be incredible.
I know. One day, maybe. And then, once we understand what's going on together, we come up with a shared understanding of what's going on. And then we create a plan that suits you, whatever that looks like, and usually it's not all medication. There's other things, there's lots of things that can be done before. There's talking therapy. There's what's going on in the family, in the house right now. Support, nutrition. You're not eating. I know when I'm not eating how I look, you're not eating well, or your iron is down to your boots, or oh my God.
There's so much that affects your mental health.
Yeah.
And on that, actually, I know you just said, this is a shame that we can't do blood tests and diagnose mental health concerns.
Yeah.
However, having a blood test, the number of people that get their 6-week checkup and don't get a blood test, and then their hormones are out of whack, their iron is, like you said,
down to their boots, and all other micronutrients are gone.
It should be like.
Why can't they make it part of that 6-week obstetric appointment?
It should be that you get your 6-week checkup and they do a blood test and check everything. Imagine how much,
preventative.
I usually have women sitting in front of me and they look quite pale, and I'm seeing them for the first time. Like, are you this pale? And they're usually thinking, why are you asking me that question, Edna? Like, you look kind of pale. I don't know you, but it's the first time I'm meeting you. And it's surprising how many women I find as a psychiatrist that they're completely anemic. And it's like, okay.
Because then you would say to them, go and have a blood test?
Well, I can do the blood test. I'll do the blood test and I'll be like, okay, well, this is what's happening. Now you need to see your GP about getting this treated. I can treat it, but it's outside my scope of practice. My scope of practice right now is to focus on your mental health. But we've identified that you need iron.
Something
your vitamin D is off.
The treatment.
Thyroid is out of we need to get an endocrinologist on board. You're bleeding heavily. What's that about?
So much.
What's going on? You're losing all your hair. What's going on? I mean, it's normal postpartum, but maybe it's a little bit more. I don't know. So this is the advantage of seeing a perinatal psychiatrist, because you take all that on board, the medical side of things, which is sometimes can be missed.
It's so good to know that there's that rounded approach, because even, up until now, chatting with you, rightly or wrongly, my association with psychiatry has been just medication.
Yeah.
And I think it's really nice for, me to understand and our listeners to understand that it's so much more than that. That's actually just one really small component of the treatment of psychiatry.
In psychiatry, we talk about biopsychosocial. So the biological factors, the psychological factors, and the social factors. So I have to take all three of them to try and figure out how to best
psychosocial.
Yeah,
I love that.
Biological factors, the psychological factors, and the social factors. The social factors are you may not have support. Your husband's working, all the time, or you're having conflict, or there's domestic violence, or whatever that, or there's substances being used, or you're not eating. Like, we have to think of all other factors, or you've just
So it's a very holistic approach.
It is.
Yeah, literally.
It really is.
You have to think broadly. You have to think so broadly. And this is the 2-3 sessions I talk about at the beginning. When you get help, when you're asking for help, once you get to me, we're going to sit there and forensically analyze what's going on. Yeah. And in doing that, actually, it's quite healing for the person to hear and putting things together and actually linking things and go, I didn't think of that. I didn't think, I'm not sleeping. Jesus, when was the last time I slept?
Making them aware of their own blind spots too, because often they're so focused on their baby's well-being that they just completely oversee the fact that they're not eating, not sleeping, and so on.
Yeah. When you actually sit down and be like, and usually they'll tell me, I'm well supported. Okay, so tell me what support is. Tell me what support. Actually, tell me what support is. I've got my mom. Okay, so how often does mom come? Does mom work? Yeah, mom works. Okay, so mom has a full-time job and she lives an hour away. Okay, so what support are you getting? I've got my friends. Okay, so tell me about your friends. She's got 2 kids. She lives 2 hours away. Okay, so who else?
Yeah.
Except my partner's very supportive, but poor guy's working all the time. Okay,
so you've actually got
dwindle down, and it's like, I've actually got no one.
Yeah. And sometimes the emotional support's there, but the physical, practical support is completely absent. Yeah.
Yeah. And we don't ask for help nowadays.
No, we don't. It's a big issue.
We've got a podcast episode just on that. You may not be able to answer this. I'm going to go off script. You're going to love this, Edna. Come on, we can do this.
Yeah, totally.
Just going back to what you were saying, and we were focusing on the holistic, because I'm so I just love this whole new aspect and perspective that I have now of psychiatry. Obviously, having home now and then obviously having my own experience with postnatal depression and anxiety, are all psychiatrists approaching their treatment in that holistic way, or are there psychiatrists out there that are just medicating?
So,
is it an obligation?
Well, our training trains us in the biopsychosocial model.
Yeah.
You know?
So if you're not looking at all three, then you're probably
missing gaps.
Yeah.
You know, we're all trained in the same way, but how you practice, that could be a little bit different. You know, like if you think about any specialist, you know, we're all trained the same way, but then how you apply your practice might be a little bit different. You know, so
I'm just thinking about, again, listeners who might, you know, I know people who have gone to see a psychiatrist, and I can tell you that they have not had that
holistic biopsychosocial.
That's, I think, why I'm like, wow, okay.
Yeah.
And they've just, look, there might be different circumstances and, you know.
It's hard to know, but generally speaking, in order to really achieve recovery, you need to look at everything.
Yeah.
You need to zoom out and be like, okay, what is going on?
Yeah.
Yeah. And it's not just, you know, me providing it has to be a collaboration. So if there's something in the social realm, I need to get a social worker involved.
Yeah.
I need to get someone to help me. If there's, you know, intimate partner violence, I'm not a specialty. I could identify it and then be like, okay, well, let's get you some help. What are the services out there? And getting the right people on board, you know? So identifying things. Because as I said, the organ you're using to try and help you make decisions is not working. I'm that organ for you now.
Yeah.
Yes.
You know, I'm that organ.
I just got goosebumps. That's such a beautiful way, Dr. Edna, to think about that.
Yeah. And, you know, a lot of women have lost hope by the time they come to me. And I hold the hope until I can see that the light's back. And I'm like, here you go. You can have your hope back.
How comforting.
You know?
Like that just feels so comforting to know that. I'm not going to cry. Let's go to the Jess asked me a question.
Very cool. But it's really heartbreaking because they're high functioning women that come to you. Like who've never had 3 dangerous points in a woman's life. When she starts menstruating, like age 13, 14, rocky, having children, rocky, and menopause. And these are well women, and then bam.
Yeah.
That was my greatest undoing. High achieving woman, successful business.
So, and those are the risk factors. That's a risk factor. That's actually a risk factor. Perfectionism is, you know, being really good and then coming to this job motherhood.
And you're like, what the?
I'm good.
Yeah.
What is this? I'm feeling not
control.
Good. No control. Everything's chaos.
Yeah.
Absolutely. That's a risk factor.
So on that, we are all about preventative care here at home, and you've just mentioned that being a high achieving woman is a big risk factor for perinatal mood disorders.
Yeah.
What are some other risk factors? What should people be thinking about when they're starting a family?
Yeah. Everything.
Yeah.
Don't do it. No, I'm kidding. It's the best, you know, the hardest and the best thing ever, but it's also the hardest. It's going in with your eyes wide open. So risk factors, you know, as I was just telling Larissa, perfectionism, our psychological makeup is a risk factor. So if we're perfectionistic, we like things going in a certain way and we like control, buckle up. If you are someone who has low confidence, who is really unsure, you know, low self-worth, this is going to make you feel even more less competent. You know, it's quite. And the other psychological factors, like, you know, our personality style is our coping strategies. If you're someone who leans into a bottle of wine as a coping strategy, or smoking, or going for a 20K run, that's my coping strategy. Well, you got to pick up new ones, you know, because that's a risk factor. You need to have solid coping strategies, you know, healthy ones.
So not a block of chocolate.
That can be helpful in moderation, but you got to have more. You got to have like a menu.
Journaling and meditation and a whole
Talking
list
to friends,
of
having a bath, reading a book, lots of things.
watching trash TV.
Reality, Real
People
Housewives.
love it. Yeah. People love Real Housewives.
I hate when Beverly Hills stops.
I
Beverly
don't
Hills is my
watch
favorite.
it. I've never watched it, but but people
I'm so
love
sorry.
it.
It's
Just great trash
And
TV.
Selling Sunset's the other one that everyone seems to be obsessed with that I haven't watched. I'm a bit behind.
Yeah.
We digress.
So you digress. Other risk factors, if you have your own mental health
Pre-existing.
concerns in the
that's what I
past.
was going to ask.
If you've had anxiety, depression, adjustment disorder, OCD, anything you've had, bipolar illness, schizophrenia, if you've had that in the past, it will show up. It might show up. I shouldn't say it will show up. It might.
High chance of it
High
showing up.
chance of
And
it
I imagine
showing
if
up.
there's a family history too, right?
Yeah,
So if it's
family
never
history.
shown up for you before, but there's a family history, it's
Mom,
quite likely to
Dad,
show up.
It will
Yeah.
show up. Because you probably already have it, but you've just masked it somehow. The genes are there.
Yeah.
We're all born with certain genes, and it just unmasks in certain scenarios. Lack of sleep, feeling overwhelmed. It shows up. Childhood trauma, neglect, abuse, all that stuff shows up. What else shows up? What other risk factors? There's if you have any chronic medical issues, that puts you at risk of developing mental illness because it has the potential to flare up in pregnancy. Things like pain, if you have thyroid issues, if you've got autoimmune conditions, it shows up in pregnancy and it has the potential to derail you. Things like social stuff, such as if you have an unstable relationship with a lot of conflict, it has the potential to derail you when you're pregnant. Financial difficulties,
Which then then we get in a catch-22, right? Financial difficulties can make it very difficult to access psychiatry.
I know.
And then it's this, what do you do?
What do you do? It's a real equity issue. Yeah, it's a real equity issue. There are psychology services that are, the government has the better initiative, that you can access psychology through Medicare and no gaps. But psychiatry, it's very rare to get a psychiatrist that doesn't have a gap. It's a real equity issue.
And the wait lists are
horrendous.
Yeah.
Being a perinatal psychiatrist, I try to keep my wait list really low because we know that 9 months is such a finite time.
Yeah.
You can't be like 6 months because the ship has sailed by then. Yeah.
I mean, there's a lot. It doesn't leave. If you broke that up over the female population that are wanting to birth,
risk factors.
everyone has a risk factor.
Correct.
I guess neurodivergence would be a risk factor.
Correct.
Gender identity
Yeah.
would be a risk factor.
Absolutely. Any loss, any recent loss, any recent stresses, like no social supports,
Yeah.
moved house, moved state, all that. Substance use is a risk factor for mental illness.
So
Poor nutritional status.
Yeah.
So
risk factor for mental
let's
illness.
just say everyone
Everyone
has a
is
risk
at risk.
factor.
Yeah.
Absolutely. Every woman has a risk factor.
And that's just flags to me why it's so important to have a perinatal psychologist in your support team, whether you need them or not.
It should be
Let's hope that you
automatic.
don't,
Yeah.
but
Yeah, it should be
just
automatic.
everyone should just have one.
Yep.
Yeah.
Yep. Okay, you're pursuing a pregnancy. All right, let's get you linked in.
So
Immediately.
that's a GP visit, go and get a mental health plan.
You're seeing your GP anyway to get a blood test to find out you're pregnant.
So really GPs should
Immediately.
as a part of that.
Yeah. But are there enough psychologists? Are there enough psychiatrists? No. Equity again.
and a lot of us don't have
finances.
17 years to redo our career, you know.
I took the scenic road. It wasn't the
On
straight
that
road.
note, you're going to come back and chat with us in the next episode, and we'll
Amazing.
delve more into psychiatry.
This podcast represents the opinions of our hosts and their guest speakers. Views and opinions expressed in the podcast are our own and do not represent that of our places of work. This podcast is for informational purposes only, and content here should not be taken as medical or professional advice. Please consult your healthcare professional for any personal recommendations and medical care. While we make every effort to ensure that the information we are sharing is accurate based on the best available information at the time of recording, we welcome any comments, suggestions or feedback via our website contact form, home.com.au/contact. Names and details of personal experiences may have been changed to allow for anonymity and privacy. To join the conversation, join us on social media at Home Postpartum.